Well, we are back continuing our discussion with Dr. Corenman about back pain, neck pain. Do you have it? Here's the science behind it. And he is with the Steadman Clinic. And earlier we were looking at a few slides that were showing kind of the anatomy of the disc,
Yes.
and looking at a diagram of someone bending over, just to give people an idea of what is actually happening. What are the physics behind a bend and a pickup?
The next picture here really shows what's happening in a simple diagram using a lever and a fulcrum. Again, going back to high school, anatomy and physiology, what happens is that if you're lifting and the load is close to your body, if you look at the diagram up there, the little man that you see on the top is your muscles pushing down. And it doesn't take a lot of energy to hold or lift that when the muscles in the back are pushing down. But if you look over on the right side, if the load is away from you, what you've done is you've increased that lever arm, and now the strain on your back is 10 times more.
Oh, wow. Okay.
And so when people say load close to your body, this is the reason. It's a real, actual physical reason.
Yeah.
So if we can go to the next picture, this is an MRI.
Okay.
And you're looking at a disc from the top down. You literally almost take a samurai sword and cut somebody in half to look at their spine. It's really cool. So this MRI, the big round or oval structure on top is the disc. And if you look, you see that line that goes down from the center to the bottom. That's a tear in the disc.
Ugh.
This person, when he lifted incorrectly and unfortunately tore the disc. And this creates significant back pain. This is where back pain comes from.
Okay.
Is the tear in the disc.
Tear in the disc.
And then let's go to one last slide. This is my favorite picture. There's an artist, a medical artist named Frank Netter. This is called the homunculus of the brain. It's a fancy term, but it really means this is how our sensory system is distributed, meaning that you can tell on your index finger exactly where your sliver is.
Yes.
But when you come in with low back pain, all you know is low back pain. You can't tell me it's the L4-5 disc on the right. Nobody does. And if you look at the diagram, it's because of how we're wired. You can see the tongue has 10 times more receptor cells than the entire lower back does.
Oh, wow.
So the reason why we can't tell where our lower back pain is or what it is simply because of how we're wired.
Okay. So, when people come in, I've got low back pain. And so many people in the United States have back pain. I mean, it's amazing how
80% will have disabling back pain at one time in their lives.
Yeah.
Yep.
So now, if sometimes it can go away naturally with some rest and maybe some exercise. What do you recommend for people?
Well, most of the time, if you just rest it a little bit and you take it easy, maybe take some anti-inflammatories, over-the-counter Motrin or Naproxen, it'll probably get better. But there are some people who develop longer-term chronic problems, and that's where you need a good core rehab program that we talked about the last time. Physical therapy, chiropractic, things like that can be very helpful to get you back going.
Yeah, because, we live very active lifestyles out here, so we
Yes.
don't want to be sitting at home.
Absolutely not.
Okay, well, Dr. Corenman, thanks so much for your time
It's
and
been my
just
pleasure.
kind of explaining more. So no twisting and no keeping the weight far from you. Bring what you're carrying in close to your body and lift with your knees. If you want to learn more about this, you can go to neckandback.com or contact Dr. Corenman 479-5895 at the Steadman Clinic. We'll be back. Ties up next with weather.